All right, looks like we're online and live. This is Bill Canada, Board of Health Chairman for Custer County, and it's Monday, November the 8th, 2021. I think it's 9 a.m. even on the official clocks here, 9:01. I'll call this meeting to order and remind everybody to silence your phones if you've got them. And the meeting is being recorded on Zoom. Is this on YouTube too, or is that only?
It is on YouTube as well.
And then we've got notes being taken here as well. So we'll call the meeting to order. Let's stand for the pledge. And Kevin, it's your turn.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Thank you, Kevin. Okay, in your official capacity, Tina, roll call.
Bill Canada, Chairman.
Here.
Tom Flower, Vice Chair.
Present.
Kevin Day, Commissioner.
Present.
Clint Smith, County Attorney.
Present.
Clifford Brown, Director of Public Health.
Present.
Okay, and that's Board of Health members is well, we're in the Board of Health meeting. We got to keep remembering that, as opposed to the chairman or the commissioner. So audience introductions.
James Gilbert, rural Custer County.
Did you get it, James Gilbert? Don't say them loud. It's hard to hear on the internet. How many we have out in? Anybody?
We have 3 people. We have George Gravlich, if I pronounce that correctly. We have George Hedberg and TJ Ballard.
Okay.
Not TJ, Tracy.
Okay, thanks. And if anybody comes on during public comment, we'll be sure to introduce whoever's out there that's not in the room. Okay, with that, any amendments to the agenda, Kevin?
No, sir.
Tom? None here either. And I know we don't have any minutes yet. Tina's on though, and we talked about it. She'll have, depending on how long this goes, she might even have them done before the end of the meeting. We'll see. Thanks. All right, reports. Anything, Tom?
No, I do not.
It's our last meeting. Kevin?
No, sir.
None here either. Okay, it brings us on to Dr. Brown, and who's our public health director, for his status on the COVID stuff. I'd like to say, first of all, thanks for, it's times are up and down, and we're really looking forward to seeing what we got today. So let's see what you're into.
Just kind of preliminary remarks.
Oh, wait a minute. One thing I've got to mention. We agreed to have this meeting once a month unless things dictated otherwise. And so, just want to make sure, because sometimes that gets lost when we meet. We move this meeting to today so we have enough time to handle it. So go ahead.
Okay. We have, just trying to keep in memory, and it reminds us repeatedly, so it's not too hard, but that the percentages and the reports from the state always lag. It is challenging.
By how much?
It varies widely. We have had, within this last couple of weeks, we've had a person who actually finally passed away from COVID before they even listed him as being positive, just to give you an idea. So when we look at the percentages that I have put out, and that I put out for you, try to put out for you almost daily, those are results of the past, not where we are at the present time. We currently have 16 positives listed in Cedars as of this morning. But then looking back, we have 31.8% 7-day positivity rates.
That's current.
That's current. That's these are all of this morning. Okay. 28.5 2-week positivity rates. We still have, one was released from the hospital, but we still have 4 hospitalized. We, by the vital statistics program reports, still are only 8 deaths, even though we know we have more. 4,872 tests reported through SIS, through the state recording system, and 409 cases. Once again, even though we know that many are not reported and that there seems to be a lag there also.
You have the actual numbers for these, or can you do that?
I can't do that because I don't know all the people who have actually been sick. So these are actually
And the
positive.
deaths.
Oh, the deaths. We have at least 11 total.
Okay.
And again, it's a long process to get those things really recorded through vital statistics. Now, what we have been doing, because we were all the way up last Friday, Thursday, Friday, end of things, we were all the way up to 43 positives on the record. And I had been putting off because I didn't want to do scare tactics, but I still want to have people, and that's why I turn numbers into Reggie every day. Still wanted to have people aware. So when we went to 43, said, okay, we have to make people more aware through our Facebook and through our webpage and through just word of mouth, so that there's some warning there. People who are highly concerned and feel that they are highly susceptible and at risk need to have enough information so they can make a response for themselves. And I noticed on our church services yesterday, we had fewer people attending.
That's because you put an alert out. Is that what
That's
you're
right.
trying to say?
That's right. Yeah, it's because we went ahead and made these results available to people.
Okay, good.
Okay. But saying that, I also am in communication. Casey is jokingly said, I need you on speed dial because I'm with the school nurse, as far as going back and forth, seeing what we have, what's been investigated, what's been tracked, who's been contacted, what their responses were.
And for the record, Casey who?
Casey, I'm sorry, Catherine Carpenter, she was the school nurse. Okay, our head school nurse. And I've also this week been in contact with the Dr. McFalls, school superintendent. So in filling out forms to access the parking lots and making it proper, everybody has their T's crossed. I hate to say I's dotted. So we have every alternate week set up for our bus to come to give vaccinations. That's even the day after Thanksgiving, because that's what it falls this particular next session.
And the bus is, clarify that for everybody, because
Okay, this is a mobile clinical unit from the state that is paid for by the state, but they actually provide Pfizer. And so they will for the children this coming week, and I'm getting a little ahead of myself, but when they come in this next time, they will literally bring the Pfizer vaccines formulated for the kids, for any parents who want their children to receive the vaccines. They have Moderna, and they have Pfizer for big people, for the adults, and they also have J&J. So there's nothing that is currently publicly accessible right now that they do not carry.
Including the booster. What's the booster?
Well, the
Brand.
booster is, well,
Make it clear. So
yeah,
if
you
you've
have,
been Moderna or other, which booster do they have?
right, they have boosters for any and all right? However, since the Moderna has been the most successful in being effective in keeping people from getting sick, we have, our county is Moderna, but we do have for those people who have gone elsewhere and received Pfizer or J&J elsewhere, they can also receive. Now, there is
Is it okay to mix them if you were Pfizer first? and
That's
you
what I
could
was
get
just
them
going to go into, the mix and match, so to speak. If people want to switch and need to switch for whatever reason, all they have to do is say so, and they will receive what they ask for, so to speak, for the boosters. On this last, let's see, we go Friday, we had 282 actual vaccinations. There were a few of those were first and second doses, but the vast majority were booster shots. And for these people who are coming in now, most of those remain. Like, we actually make appointments. So it helps keep people from standing out there and waiting, even though there is a walk-in capability. If you make an appointment, those are given priority. But,
So have there been walk-ins?
oh, lots of
So they are able to work them in.
Yeah, we scheduled a little over 150, but the rest of the 282 were.
That was for this last.
Yeah, for the last one,
Okay,
just
good.
the last visit. Okay. So that is up and running. We have that right through the end of December. So
Then it quits, it's over.
the governor has stated that he doesn't want to pay for it anymore. In fact, there was quite the kerfuffle just on Friday, pleading to please continue the buses for our vaccinations so that we can have access quickly and easily and get the results back quickly and easily.
Is that only to rural counties or where?
No, it's to every single county in the United States, in Colorado.
They have many buses. So
They have 3 buses and they go around, they have certain days, certain sites, certain times that they cover. So they, like when they come to us, they have just been to another county. They set up in the morning, next day they're someplace else. The reason that we have it on Friday,
Can you tell me what through December what of 2021? When that was
the last Friday.
the last Friday?
So the question, the governor wanted to cut things down to 1 bus. And there was a lot of pleading and reasoning and so on. And thankfully, we now are back up to 2. So we are
through December.
Yeah, through December. After that, the kind of estimation is that we will have covered most of the people who want to have booster shots and children shots and so on, because they can handle up to 400 per day. So we're trying to get everything pretty well taken care of. Plus, we do in the clinic vaccinations. But once again, because it's out the back door, so to speak, in our public health agency, we can handle about 50. That's the max. But we would like to try to cover as many as we possibly can through the bus.
Okay, so make it clear then, the clinic and the public health agency are teaming up, and the days that the bus isn't around, you all are coordinating a schedule so everybody can get it.
We have tried to set it up that way so that if you are symptomatic, you can walk into the medical clinic and hopefully with an appointment, make a phone call, give them the courtesy of doing that, and go in and get your vaccination, your testing done. You know, we want to have vaccinations essentially coming basically through us and through the public health agency, that is, and through the bus. We want the testing to be able to be done basically through the clinic and through the van that comes in every Friday, not alternate Fridays, but every Friday, and does the testing, as many people as show up. This last Friday, it was 19 who showed up. But thankfully, this time we didn't have 15 positives like we did a couple of weeks ago here. So things have tapered off drastically. But anyway, that's the program and our setup so that we have vaccinations through our public health agency and through the bus. And we have testing basically through the health clinic and through the van. So the van is situated on the Fridays between 10 and 1 afternoon in the public health agency front parking lot.
Okay.
The bus is on the upper level of the school parking lot. So they just pull in there, set up, people drive in, drive out.
Okay, take a time out there
Yes,
for a
sir.
second. Any comments on this so we don't get it lost and the rest of it is report time? You got any questions? No.
I'm good.
Yes, sir.
I have heard that there's been confusion on whether you can walk into the clinic and people have been turned down.
Yeah, if they are symptomatic, you can walk into the clinic and they will see you. Okay, if you want to walk into the clinic for a test and do not have an appointment, there's some resistance there. So you really need to let them know when you're coming for the testing.
So it begs the other question while you get into that. How do they know? How does the public know? Is it the public? You've been releasing the public announcements through
Right,
PIO. So that's how they know to go to either place and what times and
that's right.
this issue should be
And
fixed.
we also put them up on the signboards coming into town.
Well, that's good to know. Okay, go ahead with the
Okay.
part of it.
So the testing, once again, that is done in the van on Fridays, the reason we put it on Fridays is so that you would have Saturday, Sunday, Monday, when tests weren't so readily available, but then you'd have, again, out of the clinic, you'd have it on Tuesday. Then you have Wednesday, Thursday, and Friday, once again, before the weekend. Then you have test availability also. Okay, so if somebody needs, like for travel,
Mhm.
within 72 hours, you need to be able to have your tests. So you can always schedule a test on Tuesday, either through the van or through the clinic, but that pretty well almost covers most people for the 72-hour requirement from some of the airlines. So anyway, it's that split that we kind of set up to try to offer as much as we could, because we don't have the van 2 days a week. We have 1 day a week plus the clinic. Any questions on that?
Tina,
Good question. So you're saying they can go in and be tested at the clinic on Tuesdays?
Yes,
But earlier you
Tuesday.
said they could also walk in any day. So is it really only Tuesdays?
Well, no, you can walk in any day if you are symptomatic,
Okay, gotcha.
okay?
Okay.
For the testing of the van, you can walk in whether you're symptomatic or not. That's just plain straight across for testing.
So at the clinic, non-symptomatic is only Tuesday, or can you set up an appointment throughout the week?
You can set up an appointment throughout the week, but basically they try to set up their clinics because that's their focus on that day,
Okay.
Tuesday afternoon between 1 and 4. Okay, so they try not to have a group of people coming in. Try to keep it.
you're not testing any.
We do not provide any tests. No.
Good.
So those are your options, so to speak. So you have 2 places to be able to get your vaccination. You have 2 places to be able to obtain testing as needed. The tests at the clinic frequently are rapid. The tests that, this is a third option, but this is for kids. It's not for everybody else. These are for the students, and that is that Casey, Catherine Carpenter, the nurse at the school, tests the students also. So if there's any question or if they want to be coming back in, she is capable of doing testing to validate whether or not they're positive, whether or not there's a problem, so they can allow the student back into school, so to speak.
Okay, so that kind of begs the question to make sure it's complete is if they do test positive, they're sent home and quarantined. And
That's
you
right.
follow up on.
Or continued on their isolation or quarantine as the case may be. But we are trying to, and what we've done, for instance, when we had some questioned and some positives show up on a school bus, by monitoring where the people were on the school bus, it said, okay, who is in the proximity of this person? And those people are quarantined and tested before they're allowed to come back into school for the given number of days.
And you follow up on
Yes.
them and their parents and the
Yes.
people that they were in contact.
Yeah, I do, plus the school nurse does. I mean, she is directly in contact with them continuously, and I give them my number so that they have options there too. I might as well make a comment on that too. I call an awful lot of people. I try to call every single positive case to offer them answers to their questions, to offer them food, offer them water, offer them whatever kind of service they need to have to be able to survive for 2 weeks without leaving the house. Most of our people have community members, have neighbors who are actually taking care of them.
They all have phones, and you run into anybody that's been isolated that
You know,
can't be reached.
I
Sometimes everybody.
have to answer this, but some people, they do not have a phone listed. So we have to
Go out there.
reach them, yeah. And also for people who do not have food providing neighbors who will leave it on the front porch and they go out and pick it up. So there's no direct contact there. But I've literally gone down and purchased food and delivered it to the people.
So you and Catherine have dropped food on for them, or Casey?
Casey has not had to, they've all been able to handle things. There's at least one member of the family at that point who is still able to, not be under isolation, or they've been traveling or something and just coming back so they can pick up the food and prepare the family for the next 2 weeks.
Okay. Question.
10 days worth.
Just kind of a comment on that. I know the one individual you were trying to find out from me,
Yes.
when I did contact them, said that you had already gotten with them, and as did the state. So anyhow, I apologize for being late in seeing your message, but
Everything's going on. Understand very much. Yeah, the one resident from the Wetmore area who didn't have anything, after I'd spent about an hour and a half on the phone with her and kind of worked through these things and turned it over to Human Services and to the state, she has been taken care of. Oh, let's see, where was I? What we literally do for the school is look at the people who are in close proximity, because the seating arrangements and the classes, and the people who are seated in close proximity on the school buses. So beside, before, behind, so on. And we go through all of those, put them in quarantine, and then require testing before they come back into the school if they want to, if they feel like they're able to come back in sooner. Any question on?
So they get a test before they're.
Yes.
Okay.
Yeah. So again, when we are contacting people and asking them, okay, who are you around? A lot of I would say probably 75% of the people here do not want to give names, but they have already contacted the individuals by their own statement. They have contacted everybody that they have been in contact with for the last 2 weeks, or at least the last 5 days.
Mm-hmm.
Okay, so when we ask them specifically the questions on who were you around? And I know when you got symptomatic, which is why you went and got tested, but let's go back 3 days before that at least. And if there was somebody that you were inside the house with for a prolonged period of time previous to that, maybe 5 days or 10 days, we need to let them know to be watchful, to be protected out in public, and to get tested.
It kind of begs a question in my mind then, is the state also doing that
Yes, sir.
separately? And so they could get 2 calls.
Yes, they usually do.
And so that, yeah, is the state following up?
Yes.
Timely?
Yes, they try to do it within 24 hours
Okay,
of the time that they're finally diagnosed, they're finally tested, and we finally get the
as
results.
long as they have a phone, they'll
As long as
Talk to
it
the
is the
state.
phone. And sometimes, like I said, we have to do it. Not very
and you
often.
get the data to the state if they don't.
Yeah.
Okay.
And what we have done, since the state asked the questions, and I'm just going through and repeating, what I try to do is it's just like in a doctor's office, after the doctor spends half an hour with you, trying to explain everything to you, you walk out and you ask the nurse at the front desk, what did he just say? So after they get through the contact tracing, contact investigation, I try to phone them back. And so, because I expect that they will have questions that develop after a period of time when they had time to kind of sit and think about it, to mull it over. And they quite often do phone me back. And I said 24/7.
Okay. So this is a question I was asked. Why I'm asking.
Go ahead.
Just in that light, do they ask what kind of treatments are available? And what do you do if they do? Because you got to refer them to somebody.
Right. Yes, they do. And we have had long discussions about what is possibly available to them and where to go to get it, so to speak. Of course, we don't have any hospitals here, and we don't have even mobile clinics here for the treatment aspect.
Well, also it's medicines as well. I mean,
Yes.
you don't necessarily have to go to the hospital, but you'd like to know what to take if there's something besides vitamin C.
Yes, sir. Yeah. And I usually try to send them to their provider, whoever their provider is, wherever they are, if they have questions, to get directions specifically from somebody who's examined them medically and knows their history.
So in those that don't, then the only recourse they would have would be our clinic.
That's right.
And refer them.
Or to Salida.
Yeah.
Or to,
And when I say clinic, that's
yes,
sort of what it is.
yes. So I encourage people to try to establish, even if they've just moved here, to try to establish themselves with a primary care provider so that somebody gets to know them. And there's always the obligation, if that patient is your patient and you've seen them before, it's not a first time phone call in the middle of the night. You are much more humanly led to actually help them than you are to send them to an emergency room someplace to get checked in.
Okay.
So anyway, that's kind of, we've been able to contain pretty well with the schools, even though we had several positive kids, and we still have a few positive students now, but they are not knowingly or identifiably related as far as spreading to each other.
And they seem to be minding the
Yes, they are.
requirement.
Yes. Yeah, they are not allowed back on the bus. They're not allowed in school. They are in quarantine. So Casey has been
Or they're
doing,
not allowed to be going around town either.
well,
If they're
that's
recommended.
They're recommended. Yes, exactly. So let's see what else we have. One of the kind of packet that I passed out to you gives the state through the public health, School of Public Health up there, Dr. Hurley, gives what we have in that very first back of the first sheet. It has kind of a pink graph with blue on it. I'm still putting that in there because I want you to understand, I want you to see that it is the Delta, basically the Delta variant in that kind of pink color. That is the active.
Just the front of that pack look like.
Yeah, when you get to LPHA directors, epi update, yeah, it's what Kevin has in his hand. Can you find it there, Tom?
Oh, yeah, here it is.
Okay, but
I
you
think it's
notice,
in here, so.
yeah, it's
It is. Thanks.
So you notice those bars over on the right-hand side of that graph. And you notice that those are going where it kind of started out back in May. And then it's now just solid. There is nothing essentially except for the Delta variants. And this has been posed as the probable reason why we are having some breakthroughs from people who had the COVID virus infection back a year ago.
So is it all breakthroughs or are they variant,
No.
or there are breakthroughs with the normal stuff?
Right. There are always going to be breakthroughs because of the variants.
Well, that's what I asked. The variants are causing it.
Yes, the variants are causing the breakthroughs, exactly. But anyway, I just want you to know, so if you get hit with people asking you, I already had COVID, why am I sick? Well, this is not the same COVID. This is not your grandmother's COVID.
So have they changed the formula of the vaccination that work? So
No,
that-
because the Moderna has actually been what the numbers I was getting, about 76% effective. That's better than the standard flu vaccine. So better than 50%, that's a positive. That's a good thing. Okay, let's go back in that same page. I think I numbered most of yours, page 11. I wanted you to see that's comparison of US states. It has blue on the bottom of the graph.
That's the one right there.
Yeah, that's
Okay,
it.
got it.
And you see outlined in black up there, 5 down from the top.
Yeah.
Yeah, that's Colorado. So that means that we have
State for the record what you're reading. So it's a 7-day incidence per 100,000.
it's a comparison of the US states against each other for the 7-day incidence per 100,000. It was updated as of the 2nd. So it's fairly fresh by the CDC. And we are 5th highest in the nation in incidence. So we are more active. For instance, if you look clear down, second from the bottom, 56 there, it's the lowest one in blue in the bar. That is the state of Florida. You go up about 9, and if I'm not mistaken, it's about 82 to 86. There's the state of Texas. So those are 2 states which caused me a bit of a quandary. 2 states that have opened things up faster than a lot of the others. And we've been pretty stiff in our lockdowns and recommendations and so on, with masking and closing and so on. And yet we are still up there, but we are dropping down again. But I wanted you, when you talk about
Colorado.
Colorado, yes. When you talk about the spikes, when you say, okay, there's a spike in how much we are experiencing now as far as positive cases. If you go back, and I don't have my pages numbered, but I think yours is like 22 or so. You see a whole bunch of little graphs with pink and jagged lines going up. It's just a few pages from the back.
Would show me the graph. Mine's not numbered.
Okay.
Or whatever.
I believe it's gonna be this one with the red and some blues.
Okay.
So it's regional epidemic curves updated the 2nd.
Mhm.
And this is the south, which is what our region is. And if you notice, Huerfano, Custer, and particularly, we have to go back a few pages to find Pueblo, but we also, that's a spike, that far right,
On Pueblo is.
yes, and on Custer's and on Huerfanos. Fremont is showing some, but not nearly as drastic as ours was just this last week.
So what's the axis, the spike? What is that? Numbers
Yeah, those are actually numbers.
of actual just cases?
Yes.
Okay.
So anyway, when you look at a graph and you see something like that, that's fairly significant because as you notice, we were fairly low through the summer and then all of a sudden we really got hit and hit pretty hard.
That's why the alert.
That's right. That's why the alert. Okay, any questions specifically on that end of things? That's why I thought we needed to actually call the public's attention.
What was our actual number on the alert or that is on the graph here? You can read it. Yeah.
We were around 200. So it's 200 per 100,000, of course.
Right, so what is that in actual numbers to us? So we don't have
Well,
100,000.
Yeah, we
It's
had,
really kind of tough.
so we had about 43 people. Okay, and that's
Okay,
what
that's
that's
what
showing.
that's showing. Okay.
That's right. Okay.
All right.
And if we had 200 people, we'd be in trouble. Okay, so anyway, just the indication there that I was concerned, and so had to make a statement. But we're showing what I expected to be the decline, and that's back to 16, which is almost a third of what we were just a week ago, or a week plus a couple days ago. So I don't want to worry people inappropriately, but I do want them to be aware so that they can make their own decisions.
Okay.
Any questions, gentlemen?
Thanks for the data.
Yeah, sure. The hospitalizations, of course, follow the fact that we have had many more tests being done because of the van coming in. So we've updated the capacity, so to speak, of our clinic, our medical clinic here in the valley, and what people find out from going up to Salida or to Fremont County or to Pueblo. And so it seems to have worked very well and that's why I'm continuing the van, because people can just drive in, there's no appointments, there's no hassle. Within a few minutes, you have the best test, the gold standard, PCR, excuse me, and you have not only that, but the next morning, you have their lab having given you a report that's specific to you and nobody else can access it. So you not only have better than the rapid test PCR, which is not accepted by all airlines, for instance, for international travel, but you have the PCR and you have it within 12 to 16 hours. So to me, that is service, and that's what I've been wanting to see available to our people for a long time. Questions on that?
Any issues on the pediatric rates?
Well, that's my next exciting adventure here. We know that not a lot of kids have been sick. I mean, we're talking about comparison to millions of people. And not a lot of kids have been seriously sick, but we do have an increase, and that's why I gave you in the first few pages pediatrics, because that is the hot topic here. Let's see. Yeah, if you go down to Colorado's pediatric cases, that's about 2 case rates, 2 pages down in the LP.
7-day moving average per 100,000.
Yes, sir.
Okay.
And then you go on to the next, and then currently hospitalized and confirmed, so on, we go on from there. But the pediatric rates, even though there are not a lot of them, still there are a lot more. So the percentage, the increase has been significant. And that's why we have right now 4 pediatric cases on our caseload.
Before you do that, what's the color code here on? Oh, there's 4 colors on.
Okay.
So what's the
When you looking at the bar here, see orange, the lighter orange. Okay, those are the 6 through 11. Okay,
Okay, so that's what that 6 to 11.
that's right.
means.
That's what the
It's
6 to
age
11, yeah, those are ages
Okay.
that they're giving you, an age window. If you notice the 0 through 5 in the blue, that's at the very bottom of the graph. 0 through 5 is up also, but there are so few of those that it's, it's hard to make it too exciting, and not a lot of serious episodes. And we have 2 of those also, to below 1 year
Mhm.
currently. Yes, sir.
Throughout a lot of this, most everything started coming up mid-August
Yes, sir.
to September.
When school started.
When school started is
Yeah.
when I think a lot of that
Everybody
trend
was back
started.
inside, right beside each other, sharing whatever they had. And a lot of the kids went with their families to various events up in Colorado Springs and Denver and all around the United States, where the rates are higher, and came back bringing things home.
Yeah.
But that's an excellent point. So hospitalizations, that I had started to talk about, the hospitalization rate has increased with more testing and more people showing positive. So we have had not a lot of hospitalizations, but this is now more, and we're dealing with, 2 to maximum 3 more hospitalizations than we've had previously. So our rate is higher, but it's still not a high number of people. And with the increased number of people showing positive, it's not too surprising, it's predictable that we would have more people showing up in hospitals.
Well, it looks like it's quite a bit less though than our peak back in November,
Yes, sir.
December.
But we've had some serious, and we
And
currently have.
This is
some
Colorado.
Yes, sir. Yes, not anybody else.
Okay,
Okay, questions on that aspect? Consideration, whatever. So all of the counties around us, if you look back in your charts, it's 7-day incidents per 100,000, and it's on the back side of one of your double-sided sheets. Keep going through, and it's just before all of those little pink and blue charts that we already looked at. It's quite a ways back.
got page number for these.
That one, I'm sorry, I don't have my sheets numbered, just yours.
Show us what you're
It
looking
goes
at.
like this. It's a
Oh,
colored of the state.
Of the state. Okay.
Yes, the whole state. But again, there you go, Karen. That's
What page?
12,
I've got a page number.
go back to the front just a little bit.
Okay, got it.
so you'll see, and what I had essentially done it for myself was to trace the incidents as it expanded over the last couple of weeks for us and for the surrounding counties and for all of the counties in the state. But for right here, for clarity, if you notice right down there in the center south or the lower portion of the state where we are, all of the states there,
County.
I'm sorry, counties there are red. Okay, so it doesn't give you specific numbers, but it gives you kind of the trend, okay, the status. So they're kind of groups. Today, by the way, the incidence is much, much better today in what the state sent out to us. That's just a daily rate, and those things fluctuate so much, I didn't want to confuse the issues there.
Okay.
Okay, let's see if there's anything else. We have, like I told you, we will now have the 5 through 11 pediatric vaccination or vaccines available with our bus. We had 282 vaccinations, COVID vaccinations given between first, second, and third last Friday. We have, by the state's recording, we have actually done more, but by the state's records, our county residents, we have had 4,751 vaccinations. That's first, second, and potentially booster here. Third. So we have a fairly, in our 65 plus range, we have about 75% of our county residents have received at least one vaccination. So have cut down the likelihood that they're going to become ill. Doesn't protect anybody, absolutely. There's no absolute protection. For 12 plus, for the having received at least the first dosage, we have 54.5% who've been vaccinated.
That's of our records.
Yes.
But we don't know what.
No, these are all, this is a statewide. They can have obtained them in
Okay, so it's wherever they got it.
wherever they got it. This is what it's saying. For the second dose, it's not that much lower, but some, about approximately 51%, 50.9, the state's standards. So just to give you kind of an idea.
How's that compare with Colorado? You know,
In Colorado, it depends, it varies widely depending on the counties. If you go out to some of the more rural counties, virtually nobody has had the vaccination. You get into Denver, then they have a lot.
60%.
Yeah, 60 plus %. But we are not, I do not see us reaching 100%. I don't see us reaching 75% as far as an average.
Okay.
And that's been in our discussions with all the other local public health directors.
So in that light, who are you talking to? You're on a board, you're talking with at the state level.
Yeah,
How you get?
we have various, lots and lots of different committees and boards and so on, but basically all the public health directors get together on Zoom call with the state, with the School of Public Health there in Denver, and with the lawyers, the attorneys to ask questions. We also have the state leaders, for instance, Ms. Ryan, who gets on with us and talks to us, as well as Michelle.
With relationship, they've been helpful for you.
Yes, absolutely. In fact, it is nice to be able to put in a phone call, and if they can't pick it up at that time, you get it back very, very short period of time. So questions are always answered as best they can. Even the state attorney has been kind of hesitant to answer some of the questions because we don't have backing from the state. We don't have legal backing in enforcing any kind of orders. We can make recommendations, but they are not giving us support in the back. Except you need to do this, and this is what we're going to do, and you figure out.
Meaning all the counties.
Meaning all the counties of the state,
Yeah.
for all the public health directors.
Who all sits on that call? Just public health directors, or there?
Yeah, there are a few. It depends on the call. Like I said, we have so many different Zoom meetings. Some of them have PIOs, public information officers, sitting on them, and we invite people, subject matter experts, to deal with one particular area. We have vaccination calls, giving specific directions on giving kids their vaccinations, giving elderly, the problems with the various and the kind of nuances of vaccinating with the various different types, because every different type of vaccine, a little bit different in what you do.
Okay.
and how you store them and so on. So yeah, there has been a lot of support there. In addition to that, a lot of private calls. I shouldn't really mention names, but I have specific people throughout the state who have been in the state in public health for many years. And so I can.
So they'll help
pick on them.
the specific directors
Specific-
in different counties on
Yeah.
issues that might be
Yeah,
relevant.
they're open to share with us.
Good.
Sometimes it's nice to hear back that you're not the only one having this particular challenge. But quite often it's not so nice because that means nobody has
Good.
an answer for us. Okay, other than that, we have medications, and those were the first couple of pages on your handouts that I gave you. The antibody treatments, COVID-19.
Yeah.
I wanted to call attention to you and to the rest of the public down in item number 2 there on the very front page, CDPHE bus Pueblo Mall. So we've had some challenges because the hospitals are close to capacity and are on, send them on to Denver or to Colorado Springs. If you have somebody that from Huerfano County or Custer County that you need to get in.
This is for an antibody treatment or?
This is for antibody treatments,
Okay.
yes, for COVID.
So remember, there's a lot of people that don't.
Yes. I'm
So
sorry.
what is the antibody treatment? And then,
Well, there are multiple treatment approaches,
okay,
but the one that I'm really very interested in because we've seen some really good results and people within, excuse me, pardon me, within a day have said that they felt so much better when they get within the period of time that is recommended, which is within the sooner the better. Within the first 3 days, it's the best, but within the first 10 days, when you still have some antibodies of your own that you can add these antibodies to, and together they seem to do very, very well for a lot of people, not for everybody, but for lots of people. So what we're trying to do here, what has been indicated that should work, and theoretically it does, to supply enough antibodies to overcome the virus. Or at least the symptoms. So it doesn't take away, this does not cure you, quote unquote. This cuts down how sick you feel and gives you a better chance to fight it off.
or not be hospitalized.
Or not be
possibly.
hospitalized or die. Exactly. But anyway, the infusion clinic,
So what are you gonna do with this information? You're gonna
well,
put it on the web? or
yeah,
what?
what I've been trying to do in passing information to Reggie is to put things out so that she has access to that, so we can put it on our webpage, so we can put it on our Facebook. Okay, so the mobile treatment unit there, November the 8th through November 13th, that's when it's going to be at the Pueblo Mall.
What's their capacity per day?
That I don't know because they have really not published that for us. But it seems to be the people who need it are taken care of. There's a criteria. Now, the second page, the next page there, excuse me, for antibody treatments, there is a flow diagram for you to kind of help people. And this is, once again, why I sent this to Reggie, because I want this to be made available to our residents so they can kind of look down through and say, okay, do I meet the criterion or do I not? And if I don't, I still need to talk to my doc, or provider, whoever they are. But at least it gives a pretty reasonable flow chart for anybody to kind of look at it and say, okay, yes or no, or what else is there available that I can kind of play with, so to speak. So there are several courses of therapy, several medications that are being used at this time. There's not seemingly the resistance to treating that there was for a while where you're not allowed, or the docs are getting in trouble for using almost anything to try to help out their patients.
If I may.
Yes, sir.
So on this, according to your front sheet on that, do you need to be referred to by your primary care?
That is the best way. You can go into an emergency room and then they can do the referral for you if you don't have a primary care doc, but it's much, much better. It's highly recommended and much appreciated. So they don't just have floods of people showing up at their front door. So you know that there's been some screening, there's been some careful consideration given for each and every patient. Any other questions there, gentlemen?
No, I'm glad to see that they're, it's a bummer and a few months ago that if you got it, and the only thing that the docs would tell you is go into quarantine and tough it out. That was hard.
Yeah.
Glad they're
So,
coming up with
and
stuff.
there is also, and I can only speak to this peripherally, there is also in trial post-oral, a pill for treatment that is being developed. At least it's in those stages, and so far some pretty good results. So you may not have to get shot or get an infusion. The infusion takes a while. You have to plan on being there for a while, and then they have to monitor you afterwards to make sure you're not having an adverse response.
Right.
Where they just pull out the skin, the subcutaneous injection, that one you have to go back 3 more times after the first one. But the infusion is just one time. So there's good and bad. But either one, they have to monitor you for at least a half an hour afterwards, preferably a little longer.
Is the infusion Regeneron or is it something else?
They
Or
have
several
Yeah, they have several.
types. Okay.
Yeah. They're they have been passed at different levels for the various insurance companies. Some insurance companies cover one, and Medicare and Medicaid, cover a couple of them. So it's not as if you're left high and dry if your insurance company doesn't cover this particular one. It's getting better all the time. Gentlemen?
Yeah. Any other?
I don't have anything else unless I've just plain forgotten.
Recommendations or anything?
The other thing that I was just going to mention, going through, and I've mentioned this to you before, I believe, going through with all of the people who are coming into our country, bringing various things with them. Some of them are bringing various things with them. We are having to look now at TB, which we didn't for a while. Tuberculosis. And I'm going through an additional training in the relationship and how they interact between TB and diabetes. So because we have a fair number of diabetics in our valley, if they are then exposed to TB, then they're more susceptible, and that.
So how will they know?
Well, that I will.
What's your plan?
As soon as I get through the course, I will kind of try to make all that information available to you, because I'm not really, I haven't seen that much interaction. I haven't seen that many TB cases in my 50 years in practice. But since we're getting more, and we just had one here about a month and a half ago, they were applying for work here in our county and they were tested someplace else. So it was a bit of a thing with the state to try to get them tracked down.
Isolated.
Yeah, it's an isolated case now, but I just want to be prepared. also have been approached, and I believe I mentioned this to you, relative to a research project that is going on with various contaminants in water supplies, especially, and they're using 2 counties and ours is 1, because guess what? We have mines, of course, mining that occurred in this particular place, and we quite often will have various types of problems with the water when that has happened. So I'm involved with that. And we've had, and I wanted to bounce this off of you, just something to think about to kind of prepare yourselves for when we have a residence and we have numerous people with some really high readings for lead poisoning. We're talking about kids. Remember that this results in what appears to be a learning disability, severe learning disability. And you can treat it if you can catch it particularly fairly early by giving good green leafy vegetables and so on, lots of different things. But anyway, when we have a place that has been identified, and as soon as they move out of there, then the kids start getting better. When we have that type of residence that has been shown to be dangerous, in my past experience working on the reservations, I've actually shut down that residence if it could not be brought up to a standard that was safe for children, for women, particularly pregnant women, and so on. So anyway, just.
Do you have any specific concern here?
Yeah, I do.
Pipes in our system and the towns probably.
Yeah, the water, the paint, the pipes. Yeah. So I'm just kind of bringing this up to you to let you know that this may be something that I bring to you formally.
Yeah, I have a question.
Yes, sir.
Influenza hadn't gone away, and what I understand, this may not be true, that we still have a higher death rate from the flu right now than the pandemic.
Right, and what
are we doing about that?
Yeah, we are giving our vaccines, making our vaccines are ready. We have given hundreds of vaccines, influenza.
Meaning the school,
public health,
or the public health and the clinic have. Okay, I haven't heard.
Yeah, we run our influenza clinic starting usually at the latter portion of September, because that's getting into the October, November, December, January, February, March flu season.
Mm-hmm.
And so we give it all the way through, but most of our vaccines are given October, November, December as people.
Are you making the health announcements on that? Are we going to have a fair, that kind of thing? Health fair?
I'm not going to obligate to a health fair yet this year. I'm going to try, but I will not obligate to that yet because it takes so many assets. We have people who are doing a great job as far as our volunteers, and we are still using them in vaccine clinics, or COVID and the influenza vaccine clinics. So we're using multiple nurses to help out, multiple people for monitoring and checking people in and so on, just like we were doing in Lang Hall. But right now we're doing it basically out of the public health agency facility. So that's a community effort, and I appreciate it very much. And I commend those people who come in, take time out of their day and share their expertise and their licenses and so on to help us accomplish things that we couldn't possibly do with the number of people that we have.
Is that all your issues?
Not all my issues, but all the issues, that I'll report.
And Jackie's not coming in.
True.
Okay. Questions, Kevin?
Not at this time, no.
Well, I just wonder, Dr. Brown, if you know the meaning of the sign out east of town on the variable message board. I have no idea.
I have some questions when I drive in the morning.
What does it say? I don't come in.
Best community. Then there's a second line. But I know I don't. I can't answer your question.
Is that
That
a
was
Silver
not
Cliff
mine.
sign or it's ours?
No, it's not.
It's
I need
ours.
to talk to you.
It's one of the three signs that,
Yeah, I know Silver Cliff has one up on their side of the road.
yes,
Up in Silver Cliff.
and there should be one down here and one
Well, there's R3 and then Silver Cliff has one themselves.
themselves, so it's individual.
I thought maybe that was really so.
Yeah, I don't
What's it
know.
say? I didn't
I don't know. It just, the only one that I've seen is the one Tom, I think, is referring to, and that's Best Community, and I don't know. I'm sorry.
Thought you guys worked out how you
Well,
okayed it.
when
Heard
I
that Before.
am giving it, yes, okay. When it's something to do with COVID or flu or shot clinics or whatever, yeah, then those are very specific to me.
Yeah, I'll follow up with Adrian.
Thank
I
you.
don't know.
You don't remember what it said?
No, not exactly.
Best community be aware.
Be
Yeah.
Sign
aware.
coming
Thank
into
you.
town.
Yeah,
Yeah, you
96,
see
it
it.
says best community be aware.
There you go.
see, Kevin, you got your validation right there.
So I'll call Adrian and ask him.
Yeah, that's a good question. Okay,
But I've been corrected before as being one of the old guys said, well, you just don't know what the high school kids are saying. So,
Well, they're not geared towards high school. They're geared toward public health. High school students don't make public health decisions.
no,
and they're not allowed to put it on the sign anyway.
That's right, exactly. So I'm sorry, I can't
No,
defend it or.
It's really an
speak to it.
Adrian question. I just wondered if you happen to know.
No, I'm sorry, I don't. Most of them I do this, but
I'll send you an email real quick and ask him.
Okay, Clint, any issue, you think?
No.
All right, well then, let's move on. Unfinished business. I don't have any.
Nor do I.
Okay. New business, we don't have any. Okay, we're at public comment. Anybody out? We'll do it in here. Jim, go ahead. Since you took the time to come in, you get first.
Quite a few comments. First of all, according to the data I looked at of several sources, and I'm quoting from the Johns Hopkins resource.
Speak up a little bit so that they can hear you.
Yeah, I'm quoting from the Johns Hopkins resource. The data on November 4th would indicate that we had 51 cases in the 2 weeks prior to that, 51 new cases. And we got no communication from the public health board or department until the 5th. And that was listed because the CDC called it severe. And my question is, why did our public health group, either the board or the department, not raise this flag prior to that? I should point out that 23 of those cases were indicated to be on the 1st of November. So we had 25 before that. That's a lot of cases. The county citizenry should know about it. With regard to posting it, yesterday I looked on the Facebook page. The data is still from the 28th of October. So we're not getting timely data. No matter.
Can I ask Cliff a question about that real
yeah,
quick?
I was gonna say.
So
Greg, that's-
the status and the figures stuff you give us, is that posted on the website or?
I turn it over to Reggie and to Jordan to get posted.
Because I'm looking at one here on the 3rd of November that was sent to us. I've been assuming all along those were posted on our county website.
Yes.
But if they're not,
It's the same
then
email, so.
your point's well taken and all of
Well,
that.
they're on
Go ahead.
Facebook page. The only place I can find public health COVID data posted routinely is on the public health Facebook page, not even on the website.
Okay.
And that data has been outdated every time I've looked.
Well, let me tell you what I know a little bit, Jim. I know that when we started this process, we decided to put it on once a week because we let the spikes settle or not, so we'd understand it. And if it was something that warranted an earlier announcement, like we did in this case, he sent an alert out Saturday, I think it was.
Yeah, my point being is that we've been building cases for 2 weeks.
Right.
The alert
I
didn't
get
come
it.
until 2 weeks later.
I get it.
I mean,
Well,
it didn't come until after that period, and we had 26 of them well before that. But we're not hearing about it.
Are you familiar with that screen, Jim? That's on our county website. I'm showing that.
Okay, that
Now,
looks like it's, an
those-
update. Yeah, I've seen that too. Yeah.
Okay, those should be posted,
Mhm.
I'm assuming as a result of the stuff you're sending IT, but we have to ask Vernon about that.
All right, my point is not necessarily about the timeliness. It's just that when we get a significant number of cases, I don't think that ignoring that until it goes away is a prudent thing.
Just
Now,
one quick, real
How would you
quick.
identify ignoring?
Yeah, just real quick.
by not telling us.
No, wait a minute. I agree, needs to be timely. But what we agreed to do internally is to make sure that each week for sure was, and if there was something significant, because it takes a lot of time to get that on and make it accurate. And so we didn't want to put anything out that wasn't right, but timely stuff that matters, if it is a significant thing, does need to be. So we can look into timing on where's the threshold, when do we put out an additional one before the weekly report. So that's a good point.
Well,
Yeah, go ahead.
and a bigger problem, I suppose, in just looking at the data, we are a very small county, so our threshold should be very low.
Yeah.
And apparently it isn't, because we have 7
We're
cases
blowing
one day and 8 cases the next day, and nobody worries about it.
Oh, I beg to differ there, sir.
Okay.
And that's true.
Apparently, publicly, nobody's
Okay.
worrying about
All
it.
right.
Now, so the recommendation from the Public Health Agency came out on Friday, on the 5th, based upon the severe transmission of COVID in the county. And there's a whole slew of recommendations, all of which were, stepwise and all this kind of stuff. And my question there is, what confidence do you have that the recommendations are being followed?
I have no way to deal with, to follow individual residents.
Look in this meeting. There's one person there, one person here following your recommendations. And this is the leadership of the public health, not following your own recommendations. I'm sorry, that's a little disturbing. Let's see. Okay, that. A question about the kids in school. You talked about monitoring close contact, classrooms, chairs, you have that. School buses, you have the seating there. How do you monitor the close contact when they're walking down the halls?
When it is walking past somebody in the halls, no,
You don't.
no.
And that school is very crowded. So that's happening all
But
the
you're
time.
not, for any extended period of time, if you're walking down the halls, passing somebody in the hall, you're not spending any time around them enough to build up an essential viral load.
Yeah, and
Okay, go ahead, keep
but you
going.
are exposing.
Yeah.
Also, I was a little bit disturbed of your, and this is just a personal comment, that when you were talking about cases per 100,000, our 43 cases, which translates to over 200 per 100,000, you said if we had 200, we'd be in trouble. The implication there is having 43, we're not. I disagree. I think we are in trouble with 43 cases.
That's why things were changed and that's why it was set out, even though that was one day, not 7 days or 14 days or anything else. That was our high point.
Well, we've had 51 cases in 2 weeks. That's 51 cases in 14 days. 3 cases a day is 60 cases per 100,000. Okay. So I guess my ultimate question is that, well, no, there's another. How do you know that your isolation requirements are being followed?
I have no way any more than you do or anybody else.
Well, I know that they're not.
Maybe not, Jim. Don't make a broad
Well, I
statement.
know they're not,
By
because I've been standing in the hallway with a person who admitted to being COVID positive, having it, And I'm
How did
just
you know
getting
that?
over it.
How did you know that?
He told me.
Well, there you go. So-
And he's standing in the hall of the,
And so what'd you do?
Courthouse.
Did you stand 6 feet away from him?
no, I had my mask on and I moved away.
Okay.
Well, he's not supposed to be out. He's supposed to be isolated. Is the
When did we
point.
find out is the point. I don't know. He wouldn't know any more than that.
How do we
I'm not
know?
talking about him. I'm talking about the fact that the isolation process is not being followed in the county by the people.
For
And that's,
the rest of the state, Jim. That's.
What would you have
that
us
is-
do about it?
That was my question. What is your solution to that?
my solution, I would say that in the case of a public health crisis, that the Board of Health with the Public Health Agency of the county uses authority to issue public health orders.
Okay, how do you enforce that? And how would you know that they weren't going to break that also?
Well, obviously you do the business. We did this before and it worked just fine. And then you guys just said, throw our hands up because the county people don't want to do it.
No,
Actually, I covered that fairly thoroughly. In fact, that we have a lot of frustration because we have been told, well, this is what you do, and then given no authority to build the
If you
power to
read
back it up.
the
I have read
Colorado's
it many
revised
times.
statutes, right in there, county public health has the authority to do it.
Well, I'm really glad that you understand all those things, but all the rest of the public health directors in the state and those coming down from the actual officials in the state.
I'm not going to argue. Go ahead. Just make your statement.
I would just prefer that both the Board of Health and the public health director spend more time addressing the issues and getting this under control than defending what they've been doing, because it's not working.
Okay, thank you.
And if I may for a second. In regards to that, sir, and even if we were to put out an order, or Dr. Brown put out an order, you cannot legislate compliance. It is still up to the individual people to follow either recommendations or orders. You cannot legislate that.
Well,
So even
relying on
if
it in this county doesn't work.
May I finish? Even if we had an order in place, you cannot legislate that. That same individual would probably have still been in the hallway because you cannot legislate that. And I am sorry that that upsets you, but that is a fact. Now, I am done.
Okay, now I'll just comment that relying on the individual responsibility of people in this county does not work.
Okay,
That's very clear.
right.
We have a board of education person recently elected who has published that a 3 to 5% death rate is okay. We should just live with it.
Okay, nice.
All right, I'm done.
All right, thanks. Tom, you got it.
Well, I guess I'll go back to your comment because you were pretty pointed about that. I would never ask you, why are you wearing a mask? What is your problem? I would respect that. You've always worn a mask in here, and I respect that. From my perspective, whether Dr. Brown makes a recommendation or Polis makes a recommendation about wearing a mask, those continue to be individual choices, correct? If I felt like for me to wear a mask was in my best interest, I guarantee you I would wear one. I'm not going to wear one just because somebody thinks I should. That's me as a commissioner. Okay, I'm around a lot of people all the time. If I have a concern about that, I will wear that. Now, I don't see where you feel like you can come in here and say, well, you people aren't doing what you're saying other people are supposed to do. I will do that when I feel it's appropriate.
It's a recommendation.
Sure, absolutely.
Okay, I'm not wearing this mask for my benefit. I'm wearing it for your benefit.
Okay,
That's what the recommendation is all about. So by not following that recommendation, I'm not suggesting your freedom of choice for your safety is affected. I'm saying you're not considering Mr. Candace.
Okay,
And I think I'm happy because I'm 6 feet away from him. If I was worried about it, and then I also am
But you're
happy.
sitting in
to have
this
a
room
meeting.
for.
So anyway, that's my choice. But anyway, thanks for the comments. Any more? Let's give somebody else an opportunity. Anybody else out there?
Yeah, it's Jordan Hedberg with the Tribune.
Go ahead, Jordan. How come you're not
Thank
here?
you. I'm not going to get in a small, unventilated room during a COVID outbreak. So just, there you go. So first of all, I need to know what's going on with, I've had a little communication with Mr. Smith, but I want to see where the board's at finding the August 3rd or August 4th, 2020 minutes agenda and audio recordings.
Okay, you said you talked with Mr. Smith, our attorney.
He sent me a
Tell him, Cliff.
email last week or something like that saying that you were still looking, but hadn't found them yet.
Tom's got it.
yeah, Jordan, this is Tom Flower. I went through my computer and scoured it for any reference to what you're talking about. I could not find it on my computer. I
Okay.
don't have a set of minutes from that. Kelly says she doesn't have a recording from that. It baffles me why that is. The nearest thing we can find, I think it was from August the 3rd or something, but I don't have them. I cannot find them.
No, I understand. Thank you.
Yeah, likewise. And then Cliff and Clint both. Cliff has gone through his records, and so did Clint. Clint, you have a comment?
Well, I told Jordan in an email that I've looked for it. I checked with Kelly. I checked with Kara Evans because she filled it was the secretary for a little while. You were going to check with Jonathan.
Yeah,
Evans
we
to
got-
see if he had, because he was briefly the volunteer secretary to the Board of Health, and can't find any minutes or a recording of what happened on August 3rd. I think August 3rd is the date we're talking about, and don't have any answer for that. I don't know what happened to it. Somebody dropped the ball somewhere.
Yeah, and Jordan, also, from my point of view, the only record we have, I don't know really why you're asking for it. You can maybe on likeness on that, but on the October the 27th is the date that we actually hired Dr. Brown. And
Right. But the August 3rd meeting is when the discussion took place. Now, I was in on that phone call, we were using something called freeconferencecall.com, or the county was at the time before they had the Zoom set up. So that's the reason for the minutes disappearing, be my guess, but you might want to take a look and see if somebody still has an account. I'm just going off of what we published in the Tribune and wrote at the time.
Yeah, that's a good idea, Jordan. I guess I have not even thought about, maybe we were on something other than Zoom. I'll make a note and ask.
Yeah, and I'm not, I'm not trying to be a pain here. I'm trying to offer a solution on that part of it. So you could take a look, because that's at least what we wrote down on the Tribune, and I remember signing into that to listen in at that time.
okay.
The reason so that brings up the next question, which I appreciate you bringing up, which is, it is important because that's when the discussion regarding Clifford Brown being hired, particularly his qualifications and stuff like that, was discussed. Now, I understand he might not have actually come on board until the 27th, but that is part of it. And the reason I'm interested in it is this Board of Health sent the Tribune a letter demanding an apology that we printed. But as of this time right now, there wasn't a single factual statement that was correct in that letter. And at this point, if I can't confirm the last part of it, which is that August 3rd, where this board in that letter said, what was the phrasing? I didn't have it in front of me. You didn't even consider his master's of public health. It was based solely off of his experience, which is fine, and that's under your discretion, but we would have been able to confirm that in those minutes or that recording. So if we can't come up with the minutes, I'm willing to reach a compromise because the Board of Health does have a statutory obligation to keep these records. And I do understand balls get dropped. There was a pandemic. I understand. But at the same time, that letter not only doesn't carry a single factual correct statement towards the Tribune, but at the same time, the claims that you do make can't even be verified from that minutes and those meetings. So I'm willing to reach a compromise on the dropping the ball of it, but I'm going to ask that you publicly retract that letter since nothing can be verified.
Can you, I'm going to try to pull that letter up, but I'm not sure exactly how I would even go about that.
Hold on.
Do you have a date?
Let me suggest something.
We printed it, but I can't, I don't have it in front of me. Unfortunately,
This is the letter
I'm not
that-
at the Tribune.
Let me handle this a second. So our attorney, Clint Smith, sent a letter to you after we had reviewed the request you had and all the accusations you were making.
Actually, he sent it to you guys and you voted on it and then sent it to me.
Well, I'm just saying that's we asked him to send it to you. In that
But only after the Board of Health voted on it and signed it.
I
each one of
understand.
you.
You're quibbling over
No,
it. I'm telling you.
No, it's not a quibble. It's very
listen.
important.
It's quibbling because we did meet, we read his response and we voted to have him send it to you, period.
Perfect. Yep.
So that's a fact. And if you want, before, I can get our attorney to read that again at another meeting and we'll go through it. But I'm right now, there's no way right now we're going to retract anything on it. We deliberated on that. We were very conscientious on how we hired all our people in the county, and they must meet requirements. And in fact, the requirements for this public health director was also scrutinized. We sent it to the state and they concurred with it. So I'm not going any further with it at all than that.
And I'm telling you right now that you even made factual, I never called Brown a fraud. I never.
But, be respectful here.
I'm just telling you, you claimed that I called him a fraud in the letter. The Tribune did in print, which we never did. You also claimed that we called him a felon, which we never did. In fact, the Tribune still stands open to this day for these things to be verified either by the Board of Health or by Brown himself, which has never taken place.
I'll just let it drop at that then, and our attorney can address that and we'll take a look. But I'm sure right now we're not changing any position.
That's fine. If you want to talk at a future date, that's what I'm requesting. I didn't expect it today, but it is something that needs to come up. And frankly, it's actually fairly important because it's not often that you demand something with facts that aren't correct. And it's very unusual to have minutes and audio recordings disappear, particularly at such a crucial event.
All right. Thank you. And you're right. We would not have responded that way if we weren't clear on what we were responding with, and our attorney went through it. So we'll let it be at that. All right. Anything else?
Hi, this is Tracy Ballard, and I'm speaking as a citizen, and then Ted Ballard wanted to speak and ask a question as commander of the American Legion Post 170 Westcliff. First of all, I want to say the level of disrespect by some in the audience has been extremely ridiculous. I personally, for one, am very appreciative of the Board of Health and Dr. Brown for doing a good balance of making sure that our rights as citizens to govern our own health and well-being and the rights of the government as well. You guys have done a very good balance of that, and I appreciate it. And the raising of the voices and the level of disrespect by one person in the audience in particular, who is self-described as an expert on all, has been very infuriating today. And as someone in the public, I just want to say and apologize to the BOH and to Dr. Brown that that's unacceptable, and I just apologize as a citizen. And here's Commander Ballard.
Okay, thank you, Tracy. Ted Ballard, did you get the name?
Yes.
Yep, Ted Ballard. Okay, yeah, Commander, American Legion Post 170. The reason I'm actually speaking is because we have a Veterans Day banquet that's coming up on Thursday, and noticing the spike of COVID-19, and it looks like the COVID-19 variant, which looks like we have more than 80% infections are from that variant. Whether the people are vaccinated or not, they seem to be spreading that particular variant a little bit. And so I'm asking for a recommendation of whether to cancel the Veterans Day banquet we have coming up on Thursday, the 11th of November. There are about 60 expected to be there, including a major general from the Springs as our speaker. I can cancel this with no problem today. I did cancel it last year. It was mostly because of fear of COVID. Now we're actually having more COVID-19 infections, positive rates and stuff like that have really gone up. It looks like we've had a pretty good spike. I've read the public health letter that Dr. Brown put out on Friday, and I'm concerned a little bit. So we've got a lot of elderly people in that's coming to that. In fact, the three of you are all on the RSVP list.
We may just accuse us of being elderly.
Yeah, just being elderly. And I am too. So
All right, time out here real quick. So rather than put him on the spot right now in this, I think you need to get with him. You need to take him up to where you're going and let him make an informed decision. And if there's a way to do it and have people mask or not, whatever, or cancel, is a perfectly legit thing. And that's the right thing to do, is to have him work it for you. So, and before the day's out.
Yeah,
but I have to do that today because it is, there is a lot of hoops I have to jump through.
Right, I understand. You can do it immediately after this meeting.
Right.
yeah, thank you, Ted. I appreciate your sensitivity to this matter. I have been giving some thought to this very thing myself with regard to my comments to Mr. Jim here. I had thought about definitely wearing a mask if I go to that event because it's indoors. There's going to be a lot of people. I think it's a legitimate question. I was set to ask Dr. Brown if he had an opinion or a thought about what you should do if you were to ask him. And obviously you were basically asking us. So I would like to ask Dr. Brown right now what he thinks about that.
Thank you, Commissioner Flower. Yeah.
Yeah, I don't have comfort with putting a lot of people who are high risk in an enclosed space for an extended period of time. To me, that doesn't make any sense at all. I just don't think it's safe.
Yeah, I mean, it's very obvious that we're in a lot of trouble here in this county. There's no question about that. We beat around the bush. How we fix that, I don't know. Can we do some things not to exacerbate the problem? I believe we could, and maybe we should in this regard, Ted. I really respect you for giving that consideration. I know it'd be easy for you and your group to bow up and say, by God, we're going to have it regardless. We don't care. Well, I know that's not the truth. I know you do care. So I appreciate your approach on this, Ted.
Right.
You're welcome. Thank you.
Jim's got a comment.
Did you have something?
Oh, sorry.
Kevin, were you ready?
No, I think I would concur. It is a large group of people. And as you stated, some of us are getting elderly. Some of us are already there.
Oh, did you mention that?
He did, I think.
Sort of did.
I think Bill took offense to that.
No, I was good for you guys.
That's a hard call, but I think I would concur that if you have any doubts about that it would be prudent probably to not have that.
Yeah, I like the idea that you mentioned our numbers are down, the trend is down. We got things maybe under control at some level. We don't want to go busting it up again. So you want to take. So.
This could be a spreader, definite a spreader event, and I don't want to try and
Risk the elderly.
be that, well, but not just elderly, it's just everybody in fact, anybody that's, and then we've got some kids coming to it too. Anybody that actually does show up there, they can potentially be in contact with someone else who does bring in
Sure.
COVID and then go off and spread it to somewhere else. So
And it's easy to postpone it and still do it at some point. So
And we will
Jim's
be-
got a, hold on, Ted. Jim's got a comment here so we don't
Okay.
beat a dead horse.
In the interest of balancing, honoring the veterans and the safety of the event, it occurs to me that the very fact that the predominant attendees are elderly, but they're probably mostly vaccinated too. So the risk of spreading among a vaccinated population goes way down.
Right.
And you may want to talk about the idea of the usual masking in a restaurant, take it off to eat, etc., plus a vaccine status requirement if you want to go ahead with it.
Sure. Not a bad comment. Tom's got an answer.
Yeah, Ted, I want to follow up with a couple things. Again, I really appreciate you being open to this consideration. Clearly, members of a couple of churches have indicated to me that they felt like it was not wise for them to attend these church services because of this very thing indoors. And I don't want to say they were spreader events, but I do believe there are significant people that have contracted COVID from attending church recently. I don't have any data to support that, but other than the people that have called me and indicated that they felt like they'd gotten COVID from going to church. Now, I'm not saying churches shouldn't have services, but I think our churches need to look at that pretty carefully. Social distancing, maybe limit the number, but whatever that is, I don't know. But the other thing and I don't want to get into this back and forth. I just want to respect and know that I'm listening to what you say. I would almost encourage you not to have it versus making it a mandate to be vaccinated to attend. I just struggle with that whole thing. So you do what you want, Ted. I'll respect your decision either way.
All right, thank you, Tom. Yeah, I don't think that's, I don't think that everyone should be required to be vaccinated to attend. I don't think actually a lot of them are. We do have some children that are going to attend. They're definitely not vaccinated. There's also some evidence that whether you're vaccinated or not, according to the Delta variant, from what I've seen, even if you're vaccinated, you can still spread it. You can even get COVID. So it doesn't really much matter whether you're vaccinated or not. Of course, if you're vaccinated, you have less of a chance of going to the hospital. It's better. You may not spread it as easily, but it doesn't stop it. With 60 people approximately all close together for at least 2 hours, it's you do get a chance of spreading it at that point. So I was inclined, I really wanted to keep this going, but I'm really inclined to cancel it, and I wanted to hear your recommendations.
Okay, let me point out something very important here. You are exhibiting exactly what we've been talking about. You are taking responsibility. You know, we can recommend all we want, but you have looked at the facts. The facts came out. You made good recommendations, Dr. Brown, to make sure everything's square. And Jim, you pointed out there are ways to continue. It's your choice. And if you wanted to mask up, go in, that's up to you. We're not, we would not make it a mandate that you cancel it. We would recommend you would. And I think you've heard the consensus here. It's continue on. It's your choice. But get with Dr. Brown and confirm it and do what you got to do, Ted.
Okay. All right. Thank you.
Okay. Any other comments? Because I have a statement to make at the end of here. Anybody raising their hand out there?
No.
Jordan on still?
Yes.
Okay. Jordan, I want to address you right now. I want to address your November 4th article in the Wet Mountain Tribune. It is full, in my mind, this is me talking as a commissioner and a Board of Health member, of inaccuracies, and I'm going to take the time to address each one of them right now. In March,
Go for it.
in March of 21, The Custer County Board of Health, and I'll speak loud enough so we make this a record. And I also am going to send this to all the media after the meeting. The Board of Health made the decision to report COVID 7-day statistics from Cedars. We needed a consistent metric by which to make decisions with. It was and is our desire to be as clear as possible and each week compare apples to apples, and during the week make exceptions if required. After some discussion, the 7-day rolling totals from Cedars is what we chose, period. Since that decision, the CCPHA, Custer County Public Health Agency, has not deviated from reporting the 7-day totals from Cedars. Whether you agree with that or not is irrelevant. TC Smythe's numbers are different from the Public Health Agency's numbers because her sources are different. An effective reporter would not compare TC Smythe's oranges to the Public Health Agency's apples. The fact is that Dr. Brown reports the numbers exactly as they are in Cedars. Your accusations that Dr. Brown has been silent and that Dr. Brown refuses to let the public know of COVID cases, hospitalizations, or deaths in a timely manner is flat out false. As you reported in the Tribune, the Board of Health decisions a few months back that the updates on statistics would be posted 1 time per week. The Public Health Agency continues to meet that requirement, and the 7-day statistics from Cedars are posted 1 time per week. The Public Health Agency does not report any statistical information until it has been verified. The state reporting system, Cedars, is woefully slow sometimes. Nevertheless, we do our due diligence to report only those statistics that are confirmed, which means your accusation that the reported information is incorrect is also false. The reported information is in fact correct at the time it is reported. Unidentified sources, what a neighbor said, and Main Street hearsay are not reflected in our numbers. We only report what is confirmed and verified by the state. You do a great disservice actually to our community when you incorrectly write that our public health agency does not answer or return phone calls to its residents seeking information on vaccines or testing or boosters. Simply not true. We heard a lot of it today, what's been going on. The fact is that our public health agency employees are answering phone calls and fielding questions every single day. Our public health agency talked to more than 100 residents and scheduled their booster appointments the week of October 25th. By the end of that week, more than 300 residents had been vaccinated. In the month of October, our public health agency also spoke to more than 100 residents about the flu vaccine and scheduled them for their shots. In October, after nearly a year of persistence, Dr. Brown was finally able to bring free COVID testing to our county every Friday. He was instrumental in getting that to happen. This is contributing to the current increase in confirmed COVID cases and is also enabling Dr. Brown to better identify where the virus may be circulating and to talk to those infected and their contacts. Ask Dr. Brown about the restaurants that he's worked with and other things that he's been doing. He's taken actions as it relates to contact tracing wherever it's necessary. And in this case, he's going to help with the veterans dinner. Since March of 21, we have not received a formal request from you, Mr. Hedberg, or and for an interview of any public health agency employee that I'm aware of, or any board of health member. Yet you continue to write articles and stories about the decision makers and the process. What competent reporter relies on hearsay instead of going to the correct source for the information that you print? Communication is key to getting and keeping our community safe and healthy, period. The Board of Health and the Public Health Agency are doing the best they can in uncharted waters today. You know, it's been nationwide, it's been a new experience for every citizen of the United States. Your help instead of hindrance in communicating facts is key. And you are not doing your job. I think you owe an apology to the citizens of this, because if they do not respect a recommendation, just like commander of the veterans or the American Legion did, to ask for advice and what's best to do, then they are scared off of doing the right thing and possibly could risk their own health or their own family's health by being afraid to understand and follow some of the recommendations that the public health agency is making. So that's the end of my statement, and I'm not going to debate it. I am going to put this on the website, and we can deal with it later.
So you're going to level accusations at me without letting me respond.
That's correct.
Yeah, I've got it.
You can respond, and that's fine. I just wanted to make the statement, and as you did earlier.
So I respect your right to write this up and take the
It's
time
mine.
to say this in a commissioner meeting. I don't know that you have a right to decide you're by yourself that you're going to put this on the website.
Oh, well, that's true. I'm sorry.
So,
I'm
I just
going
want
to
to
recommend that we
caution you,
put it on the website. That's
Because
correct.
you said you're going to send it to everybody and you're going to put it on the website. I don't think you have the authority to do that.
No, I agree.
Represent us.
I agree. I'm glad
I
you pointed that
respect your
out
personal
because
opinions. I do.
that was,
Yeah.
that's exactly right. And I believe it should be. I should retract that and make that clear. You're 100%.
I'm not
right.
saying I would vote against it. I just,
I understand. I really do.
Yeah.
And I'm glad that you're here to keep it straight. So thanks. All right. Any other questions? I would adjourn this meeting then at 47 minutes to 11. Thank you.
thanks, Jim, for coming in.